Good afternoon, everyone, and thank you for joining us on the third and final day of ParkCon. We really hope you've been enjoying the event so far. In this session, we'll hear about how people affected by Parkinson's are shaping and steering the development of technology to better support them in their daily lives. We'll also hear about technology that is already available and where the future may take us. I'm your host, Liz Nash, the Research Support Network Manager at Parkinson's UK, and I'm delighted to be joined by Dr. Rosie Morris, a physiotherapist and senior lecturer at Northumbria University, Elaine Webster and Gerry Standerline, co-investigators with Rosie and involvement volunteers for Parkinson's UK, Dr. Natasha Ratcliffe, who's the Research Involvement Manager at Parkinson's UK, and later in the session, you'll also hear from Jeff Gould, who is the Associate Director of Transformation and Culture at Parkinson's UK. I'm really looking forward to hearing more, and we'd love to hear from you too, so please do share your comments and reflections in the chat. After the main session, our speakers will be available live to answer your questions. So if you have any questions, please do enter them into the Ask a Question box, and we'll get through as many as we can when we come to the end of the session. Like all of our sessions, if you want to watch this back, or if you have any technical issues during the session, don't worry. Everything is being recorded and will be available to watch on demand for 30 days following the event from the Catch Up video library. Thank you again for joining us, and I'll now hand you over to Dr. Rosie Morris and her team. Enjoy the session.
Hello everybody. First of all, thank you Liz for introducing us and welcome everybody to our presentation. We'd also like to thank the organisers for inviting us to speak today. So today myself, Elaine, Gerry and Natasha will be presenting on iFall. This is an app that we created for smartphones and tablets to create a prototype for falls reporting in people with Parkinson's. So just an overview of the talk that we'll provide today. First of all, we'll introduce you to iFall, so the prototype we've created of the app and the idea and how it came about. We'll then be talking about our experience co-producing the application and the process that we went through. I'll then introduce you to the current prototype that we created as a group, and I'll then hand over to Gerry and Elaine, who are the co-principal investigators on this project, to provide their experience of co-production. We'll then hand over to Natasha from Parkinson's UK, who will provide further information about the opportunities for co-production in the future. And finally, we'll talk about what's next for the iFall project. So first of all, why did we create iFall? So the idea for this app for reporting falls came about actually from a different focus group. So for a different research project altogether, I worked with people affected by Parkinson's to discuss the ideas around a research project. And the main measurement we were using this research project was falls diaries, as the main thing we wanted to measure was falls over a period of 12 months. So within this focus group, I discussed with people affected by Parkinson's about using these paper diaries and completing those over a year. And the feedback I got was that there must be an easier way to do this. Actually, the current gold standard, so the best way to measure falls at the moment is by using these paper diaries, and it's the best thing we currently have. Although it is problematic, it's quite burdensome for both the people completing the diaries, but also for the researcher kind of posting the diaries out and collecting the information. So we do need a better way to report this in the research world. And if we used something like an app, we could then log falls when they happen. It may provide a more reliable research tool for different research projects, but also what we wanted to provide was a tool for healthcare professionals as well. So if people could use an app to report any falls that happened and then discuss this with either their doctor, Parkinson's nurse, physiotherapist or occupational therapist, they could give this information a little bit more easily. So from this focus group, we came about with the conclusion of, how about an app? Could we create that for this research project? So after a little bit of time, and we managed to secure a small bit of money to produce the first prototype of iFall. And I did this as a co-production project with Parkinson's UK. So with a lot of help from Natasha and Annie at Parkinson's UK, we managed to do a co-production project. And this was a big learning experience for me, and it was really beneficial. So this is just a little bit of information from the Parkinson's UK website, and Natasha will tell us more a little bit later. But the essence of co-production is about sharing power and responsibility throughout the research project. And so researchers and people affected by Parkinson's have an ongoing dialogue and have joint ownership over the key decisions on the project. So some examples can include being a co-researcher, as well as working as a group of people to design a new resource. And I hope that with the iFall project, we've managed to do both of these things. So the first step of the project was to identify some co-principal investigators. So a principal investigator is someone who manages a research study and runs a research study. And within the iFall project, I was the PI, but I also wanted some co-PIs to go alongside me to develop the app. And this is how we created the project team. So working really closely with Natasha from PD UK, we put out adverts to ask people if they were interested to join the project. And we managed to find some great people in Elaine and Gerry who bring really great expertise to the project. And you'll hear from them a little bit later. So once we had the project team on board, we worked together to advertise for some project advisory group roles. So this was a group of people who were affected by Parkinson's who could help us design the app and take the app idea further. So we advertised for some project advisory group members, and together as a project team, we worked with the advisory group to develop the current prototype of the app, and this process took around 6 months. And currently we're working as a project team to deliver phase 2, which is currently ongoing. So the project advisory group then, and you can see some of the members there on the screen. So these were monthly meetings, and sadly they weren't in person because of COVID. So this whole process took place at the end of last year. So it's 6 months, and although it had to be online, I have to say there were some advantages to that, in that we weren't limited to people applying for the role who weren't necessarily in the northeast of England to help design the app. So people from all over the UK apply for these roles. So as a project advisory group, once we had the group in place, we had some initial discussions and a brainstorming session. So Gerry, Elaine and I had already come up with a kind of brief prototype or idea of the app itself, and we discussed this with the team and presented them with the idea to get some initial feedback. Following this, we asked the project advisory group members to download the first version of the app and use it for a week or so, and then provide some more feedback. And we did this process a few times until we were happy with the final prototype that we created. And so together as a group, we co-created the first version of the iFall app. At the bottom of the screen, you can just see part of the advert we gave for the Parkinson's UK Project Advisory Group role. And as you can see, it included things like being confident with reviewing documents. For this project in particular, you had to have access to a smartphone just because of the nature of the project, and also just being, and most importantly, being enthusiastic and willing to contribute to all aspects of the project. So the current iFall prototype, and I'll just play a video here so you can see what we have developed so far. And so the first step of the app is that you have to register your details and register a little bit of information about yourself. So I'll let the video play in the background there, but in the green icons on the screen, you can see these are really what I think are a small number, but also really important ideas that came from the project advisory group. And as I say, this is just a very small collection of some really great ideas that we had. But from working with the project advisory group, they sort of recommended things like simplifying the app and reducing the number of words on the screen, adding different icons to the app, providing larger buttons, providing feedback such as audio feedback or vibrations when a button was pressed so that you knew that you had selected a particular option. On the video there, you can see the welcome to the iFall screen. And this is just some information that you supply once you register. So a bit of information about medications that you take and the times when the medications are taken, So you can select multiple times at which you normally take your levodopa medication. So once that's done, you press next. And then we also ask you about any previous falls that you may have had and how many falls in the past year. And that's the registration process complete. This is the home screen where a fall can be reported. And here we had a fall or a near miss could be selected. We added definitions, which are some good ideas from the advisory group and the project team, although we're still not clear on our definition of a near miss, and this needs more work. So then you can log when your fall happened, whether it's today, yesterday, or put in a certain date. Another really great idea we had as a group was to provide the interactive clock face, so it was really easy to select the time that the fall happened. We added causes of falls, and again, these options were discussed quite extensively to make sure we had the most common causes that we could find as a group. We also added options for where the fall happened, and again, we discussed these and made sure we had the correct options available. A bit of information about how you landed after the fall, if any help was required, whether there was an injury, and again, as a group, we came up with the kind of options that we liked, and also the emoji screen. And again, that was a big debate in the project advisory group. And that's it, that's the fall reported. And the other option you can do is create a fall report where you can then take that to your medical professional to have a look at all the falls that you've logged to date. Okay, and on to phase 2. So what have we found so far? This is just a little bit of data from the app. So we asked about 15 people across the UK to download the app, and we're currently testing what we call usability. So how friendly is it to use the app, and what problems can we find before we take the version any further? So we're halfway through phase 2. So far we've logged 122 events, so that's falls or near misses, and the average time daily spent on the app is around 5 minutes 43 seconds when somebody uses it. And then this is just a little bit of data that we've gathered from the app, so information about where the fall happened. This is mainly at home, but sometimes outdoors. More falls have been logged than near misses, and in terms of causes of falls, the most common we found so far are loss of balance, trips, and turning. Okay, so I think I've spoken enough now, so I'm going to hand over to Elaine and Gerry, who can provide you with information about their experience of co-production.
Thank you, Rosie. I'm Elaine, and I'm going to outline some of the reasons why I am interested in applying to the part of the core advisory group and reflect on my experience of being part of the team working on the IFOP project. I was on the Parkinson's UK research group mailing list as a person living with Parkinson's. I applied to the project because I felt it was a good opportunity to build on the skills I had and develop some new ones. I wanted to learn about research into Parkinson's, and this project focused on making recording falls easier, which I felt was a practical application. I felt curious and I thought it would be interesting and enjoyable. I particularly valued the opportunities to complete the training course, Research Involvement, which was offered by Parkinson's UK, just right at the beginning of the project involvement. This looked at a range of aspects valuable to anyone participating in research projects. One aspect looked at the vocabulary used in research and helped you look at it critically. I felt encouraged and supported in taking on the role in the core project advisory group. I liked the idea of keeping an involvement diary, which helped me take time to reflect on what was happening. At one meeting, I was feeling a bit discomforted by a comment about Parkinson, and the diary helped me raise it with the core advisory group and with Parkinson's UK. We set out some guidelines for our next meeting, and this felt constructive. I felt listened to and supported. I agreed to be a link with the wider group, and this involved emailing round the wider advisory group and supporting their involvement, passing on queries. If I needed help with technical aspects, I felt that was available. I got help with the doodle poll, and I hadn't used Google Documents before, so an alternative was used. Templates were suggested, which I was comfortable with. I could just get on with updating people about the meetings. It was really interesting to hear different perspectives and experience from Rosie, from the app designer, and from my colleague on the core project, and the advisory group. The wider advisory group included Parkinson's, people with Parkinson, and also carers, all contributing feedback and their experiences. The work of the project took place during COVID. Although it would have been nice to meet people in person, meeting on Zoom gave me a sense of purpose. It was great learning new things and helping to develop the app with others when other aspects of life were concealed. It felt very positive and it boosted my confidence. I liked it for the fact that it was an extended piece of work because it felt there was a chance to look at issues quite thoroughly and consistently felt that contribution was valued and encouraged. Rosie shared updates and papers regularly and generously. Our catch-ups involved humour and sensitivity, which was motivating. It was great to learn that the posters were going to be used and shared at conferences and the work was being disseminated further. It was an excellent opportunity to learn from research and help shape the direction of the project. The project felt innovative and helped me in the ways that we were working, involving those affected by Parkinson's at the earliest of stages and at the core project. I valued being part of the project and informing the development of the app, but most of all, I appreciated the way it was done, particularly the respectful way that it progressed. Thank you.
Okay, thanks for that, Elaine. I'm Gerry Standerline. I have Parkinson's. I was diagnosed about 6 years ago, and I've got nerve damage to my left foot due to a back injury. All of that means that I tend to stagger about a lot and fall over quite often. I'm also a retired computer manager. So when I saw this opportunity on the Parkinson's UK Research Opportunities email, it sounded an ideal project for me to get involved in. My role was the same as Elaine's, and I'd like to endorse everything she's just said about the way the whole thing works and the feeling of being valued and having your point of view taken into account. However, I don't want to say exactly the same thing as Elaine's just said. So I'd like to go through the lessons learned from my perspective on the project, because all projects have things that go well and things that go not quite so well. So in no particular order, I've made some points about lessons learned, which I'd like to run through now. To start with, recruiting people to take part in a project can be quite difficult. Rosie mentioned we've got 15 testers. We actually wanted 20, but were unable to fill all of those posts. And that was despite a recruitment campaign led by Parkinson's UK and Rosie using her contacts. It's important, therefore, irrespective of the size of the project, to recruit early. Now, there's always going to be reasons why there'll be problems, and maybe in this case it was that the 6 months commitment was seen as too much of a commitment by people. But whatever, I would stress that recruitment is best started early rather than late. We set off with the intention of putting the app onto both Android and Apple, but in the end it's only on Android. Now this maybe doesn't help with the recruitment because we in effect excluded some people who would be interested simply because they didn't have access to the hardware. Whatever, the lesson there is try and set achievable targets. And it wasn't anybody's fault that we didn't go onto Apple. We ran out of time, basically. Terms used in the project need to be defined and agreed as soon as possible. In some cases, this is harder than it sounds. Rosie talked about near misses, and we had extensive discussion about what constituted a near miss. It ranged from, is it a simple stumble or is it something more dramatic? And the definition ranged from something very technical that came from Rosie that I didn't fully understand, I must admit, and ended up with the thought you were going to fall over but didn't. The end result was that with no clear winner, the near-miss reporting by people doing the testing varied considerably. And that was really something that should have been sorted earlier than we did. It crept up on us, that problem. The COVID has already been mentioned, and COVID was with us all through the stages of this project, but it didn't really cause a major issue, but it complicated life. For the project team has never met face-to-face. Now, use of Zoom was a viable substitute, but what was missing, apart from Rosie providing tea and biscuits, was that we didn't have chance as a group to meet more informally and talk through things in less of a pressured situation. And maybe if we'd have had that, things that I've already mentioned would have not been such an issue. It's important to give all members of the team, and by that I mean the whole team, not just the initial team of 2 or 3 people, but the testers as well. It's important to give them opportunity to air their thoughts and ideas. This requires not only encouragement of those who are maybe a little shy in coming forward, but also the other side of the coin is making sure the more talkative members of the group don't take a too large a role in the discussion and distort the issues that are being talked through. If they don't do that, there's a risk that focus would be in the wrong areas or less than ideal areas. Scope creep, and by that I mean adding extra things for the app to do or adding extra things to lists, needs to be watched out for and needs to be controlled. That's not to say that you don't try and make improvements as you're going along, but you have to make sure the improvements are just that they are improvements rather than just extra workload for the IT people. The advisory group have a central role here in discussing proposals that have been made for changes and deciding whether they should be put forward or held for a later stage of the project. Finally, and perhaps most importantly, I think that you must remember that projects are all about people. And if you keep that in mind, then you're probably not going to go far wrong. Now, I hope that's been helpful and of use to future projects. And now I'll pass you back to Natasha at Parkinson's UK.
Thanks so much, Gerry, and thanks Elaine and Rosie as well for sharing your experiences and sharing about the project. It's really brilliant to hear how the team have been working together, and I think it's a really great example of co-production. So I'm Natasha, I'm the Research Involvement Manager at Parkinson's UK. So my role is focused on supporting researchers and people affected by Parkinson's to work together to help shape research and make research the best it can be for people affected by the condition. So I'm just going to share a bit today about our involvement in the project as Parkinson's UK and how we supported Rosie, Elaine, Gerry and the wider team to work together, and a bit about how we want to support other researchers to do this as well. So as Rosie mentioned, she'd previously worked with people affected by Parkinson's before this project, and we'd supported Rosie with something called a Research Involvement Award. So that's when myself and colleagues from the research involvement team provide really hands-on support to researchers to help them. Perhaps they might be new to working with people affected by Parkinson's. They may not have done it before. So we provide hands-on support to plan and carry out patient and public involvement activities. So after that initial project that we worked on with Rosie, Rosie then got in touch after something, as she mentioned, something that came out of that project was the idea of a falls app and being able to have an easier way to report falls. So Rosie got in touch and we started to chat to her about how we could build on the work that she'd done previously with people affected by Parkinson's, and support her to involve people moving forward as well. And at the same time, myself and my colleague Annie had been having lots of conversations about co-production, and we'd been thinking about our role as Parkinson's UK in supporting people affected by Parkinson's to be co-researchers, and supporting researchers to work with people as well, and how we could support people affected by Parkinson's to take more of a leading role in research, like Elaine and Gerry have done in this project. So one of the questions we were asking ourselves was, well, how does co-production differ from other kinds of involvement activities that we were already supporting researchers with? And really helpfully, this was a conversation that other charities and other research funders were having as well. And so we were able to look at some of the principles of co-production that other people had started to put together. So as Rosie mentioned earlier, one of the key things that is really central to co-production is the sharing of power. So rather than the research being led by a researcher or researchers, the research is jointly owned by everyone working on the project, and decision making is shared as well. And I think this has really come across in how both Elaine and Gerry have spoken about the project, that it's very much Gerry was using "we did this," we did that, and it's really really powerful demonstration of the fact that it was everyone working together, rather than it being just led by Rosie. Another thing that's really important, and again I think has really come across in what we've heard from Rosie, Elaine and Gerry, is building and maintaining relationships. And I think it's been really interesting to hear from the three of them about how those relationships evolved as the project went on. And that's something which is really important. As Elaine mentioned, her involvement has been over a long period of time, and it's really important that across that period researchers and the people involved work together to build those relationships and put that time in and maintain those as well. And again, with co-production, something that's really important is that everybody benefits from working together. So the relationships should be reciprocal. Sometimes when involvement activities are a one-off, it can be a bit, people affected by Parkinson's work with researchers in one way, and then the researchers get the information they need, and then that's kind of it. But in co-produced projects, it's really important to think about how everyone is benefiting from working together. So in the support that we provided for this project as Parkinson's UK, we felt it was really important for us to take a principled approach to co-production. And really think we worked with Rosie initially, and then of course with Elaine and Gerry moving forward, to really think about where and how co-production would bring added value and benefit to this project. So we know that not every research project can be co-produced in this way, and that's okay. But for this project, we felt that, yeah, it would really, and as you've heard, it really brought, added benefit to the project to have Elaine and Gerry working as co-investigators on the project. And so once we'd got a bit more familiar with the principles of co-production, we started to think about how practically we could support more research projects to work in this way. So here you can see some of the key features of a co-produced project. So we spoke with Rosie about how we as Parkinson's UK and the research involvement team could support her with some of these things as she looked to co-produce the app. So one of our key roles, as you've heard already, was connecting Rosie with Elaine and Gerry and supporting the initial development of those relationships. So we facilitated meetings between the team and helped them to get to know each other and help them feel comfortable. One of the other things we encouraged was regular feedback and evaluation throughout the project. So Elaine mentioned earlier the use of involvement diaries. So all of us, including ourselves at Parkinson's UK, Elaine, Gerry and Rosie, we all completed diaries where after each meeting we wrote down how we were feeling about the project and things that were going well. As Gerry mentioned, learnings like that we could take forward and how things could be improved. So that was really useful, and I think it was really useful for us as well to reflect on our role in the project. And as the project evolved, we found that actually we didn't need to be involved anymore, and actually Rosie, Elaine and Gerry and the advisory group then kind of held meetings without us needing to be there, because we were kind of there in the background if we were needed. But it was really great to see that the work evolved, and the project team were just happy to get on with it, and they'd really established those relationships working together. So that was really great. But as I said, they always knew we were there in the background if we were needed. And so we really want more researchers to work with people affected by Parkinson's in this way. As I mentioned, I think this project is such a great example of co-production. So at Parkinson's UK, we're really thinking about, well, how can we support researchers, how can we support people affected by Parkinson's to get involved in these kinds of projects? So when we fund projects at Parkinson's UK, one of the things myself and my colleagues in my team are doing are meeting with researchers to discuss their patient and public involvement plans. So similar to when we spoke with Rosie at the beginning of the IFOR project, we're really asking researchers, how are they going to be working with people affected by Parkinson's, and exploring whether there are opportunities to co-produce the research. I think, this project and an app was a really brilliant opportunity, and we're really keen to provide more opportunities for people affected by Parkinson's to get involved in this way. So if you are interested in working with researchers like Elaine and Gerry have, then you might be interested in becoming a patient and public involvement volunteer. So you've heard a bit from Elaine and Gerry about what this involves. The real focus of it is about giving your insights into what it's like to live with Parkinson's on a day-to-day basis, whether you're someone with the condition yourself or a friend, family member or partner or carer. It's really about using your daily experience of Parkinson's to help improve research. The role is really flexible, so there's lots of different ways you can be involved. Not every opportunity is as involved as Elaine and Gerry have been. So if you're looking for something a bit lighter touch, then you can kind of get involved in opportunities that are more one-offs. But as I mentioned, we're really trying to do lots to support more co-production opportunities in research as well. There's lots of different ways you can be involved, from helping researchers to identify important research questions, commenting on study documents, helping research design studies, or, as we've heard, co-producing research like Elaine and Gerry. It really is very flexible, and we'd love to hear from you if you're interested. So please do get in touch with the team if you'd like to find out more. I'll now hand over to Rosie to close our session.
Thanks, Natasha, and thanks, Elaine and Gerry as well. So what's next for iFall? As we said, we're currently in phase 2, and there's still people across the country using the current prototype. So at the moment, we're trying to find more problems so that we can have solutions to the current version of the app. And we're hoping to get feedback from these current users by doing some more focus groups to really get some detailed insight onto what problems they found with the current version. And then we hope to recruit another steering group because we want to move on to then develop the next prototype of the app, and including all the problems that we've faced so far, as well as the feedback from the people currently using the app. And then hopefully we can go on to develop a further prototype and to trial this in larger numbers of people who may want to use the app, as well as possibly in other research projects. And so I just want to move on to thanking the organisers of the conference. And thank you very much to Elaine and Gerry. It's been really great working with you, and I look forward to continue working with you over the next few months. Massive thank you to Natasha and Annie at PD UK, who have been so supportive throughout the whole process. We couldn't have done it without you, and you've really guided us along the way. So thank you very much. And also thank you to the funders of this project, which is the Private Physiotherapy Education Foundation, for allowing this to be possible as well.
Thank you very much, Rosie, Elaine, Gerry, and Natasha. That was a brilliant example of co-production in research and how people affected by Parkinson's are really shaping the development of technology to support them in their daily lives. Thank you again for being here. And for anyone watching today, if you have any questions for Rosie and Natasha, both of them will be here for the live Q&A. So we look forward to hearing your questions. I'm now going to hand over to Jeff Gould, the Associate Director of Transformation and Culture at Parkinson's UK, and he's going to tell you a bit more about our Apps and Devices library. Over to you, Jeff.
Hello, everyone. I hope you've been enjoying the conference so far. My name is Jeff Gould, and I am Associate Director of Transformation and Culture at Parkinson's UK. Now, one of my roles is to be part of our work looking at devices and apps that could help improve the lives of people affected by Parkinson's. At present, this is still quite a small area of work, but one that is growing, and we would like to be able to dedicate more resources to over the coming years. So today, I want to talk to you briefly about why we as an organisation think this is important, what we're currently doing, and how you can get involved. Parkinson's UK is interested in the area of mobile health, or mHealth as it's called, because of the potential benefits of technology to support people with Parkinson's. And our confidence in this area is buoyed by the rapid growth of the mobile health market and the penetration of smartphones. The World Health Organization describes mHealth as the use of mobile and wireless technology to support the achievement of health objectives. At Parkinson's UK, we simply call them devices and apps. In 2020, the mobile health market was valued at $56 billion, and depending on whose projections you believe, could be worth anything from 5 to 15 times that figure in 10 years' time. So clearly this market covers all health conditions, and it's being driven by conditions such as diabetes and cardiovascular disease, particularly in the United States. But some market research is projecting that mHealth for neurological conditions is anticipated to grow at the highest rate over the next 5 years. This would be amazing because I'll talk shortly about the lack of current products in this area, and we'd also like to be a big part of helping to ensure that those focused on supporting people affected by Parkinson's are the most effective they can possibly be. It is probably important to say now that as Parkinson's UK, we do not make our own apps or devices. This is not our expertise. Where we do have expertise is through our services, research, engagement, and transformation teams that come together to support the app and device developers who have the technological knowledge and the drive to make their products a reality. Our stated purpose is to coordinate and drive forward exploration of how devices and apps can be used by people with Parkinson's and professionals to improve life with the condition and accelerate breakthroughs in research. We focus on curating the best existing and emerging technologies made by others rather than creating our own. So what does that look like in practice? Well, we champion and signpost to apps and devices for people with Parkinson's and professionals. We offer guidance and advice to companies and individuals to encourage creation of great devices and apps and to help them understand complexities and regulations. The level of advice given is proportional to the potential of the tool and the team behind it and the support they may need from our internal teams. We're not able to offer bespoke support to every company that approaches us. A small number may get more in-depth support if the product holds significant or evidenced promise. We also facilitate an assessment process to get better quality products tested and made available and reduce the risk that unsafe devices and apps are promoted to our community. And that last point is a really important one. How do you know if an app, for example, is safe? You can read reviews, but what else can you do? So as part of our process, we have recently engaged an assessment partner called ORCA, who are the Organisation for the Review of Care and Health Applications. ORCA are a leading independent digital health evaluation organisation, and they have just undertaken an initial market review of apps for us. And it was a fascinating challenge because of the breadth of Parkinson's symptoms. This initial review focused on apps that identify as supporting people with Parkinson's, as opposed to those which might support a specific symptom, for example, helping someone to sleep. ORCA's review examines an app's compliance with relevant standards, guidelines, and best practice in 3 distinct areas. These are data privacy, clinical assurance, and user experience. And it is through these lenses that they apply a 350-point review process against which all apps are scored. And it was really enlightening for me to see the numbers of apps in review decrease rapidly once these quality filters had been put in place. Of the 13 apps that ORCA had previously put through its review processes, only 4 made it through to us as being good enough. 2 of these were actually already on our modest library of 6 apps that sits on our website. And when ORCA looked at the wider market of Apple and Android apps that they hadn't reviewed, we saw that there had been a big increase in Parkinson's related apps over the past few years. But when filters were applied looking at availability in the UK, those that were updated recently within the last 18 months, those available in English, and then those that were suitable to go through the formal ORCA review, the market shrunk from a healthy 359 apps down to just 31. 31 that will undoubtedly reduce further once they put through the ORCA review process. So on a positive note, there are more apps out there that we can explore, which is great. But it also demonstrates how few high quality products are currently available and being developed specifically for people with Parkinson's, which is disappointing for the world's fastest growing neurological condition. It means that there is plenty more work for us to do to help ensure that better products are being developed. It also means we may have to take a different view, so we may have to take a symptom-specific approach to our work. So as you can see, ORCA's reviews are hugely important for helping us to understand that an app is safe. But this isn't the last step on the journey for us. As previously mentioned, our internal experts are there to add their particular experience. But more importantly, we also need to know that it's useful for people affected by Parkinson's. And this is where our technology panel comes in. We have a group of people with Parkinson's who are interested in testing technology, devices and apps to provide the perspective of the people who will actually use it. This is a hugely important step for us and one we would never miss when adding an app or device to our library. And as mentioned, you can find our library on our website. So, how can you get involved and make what we are starting to do even better? Well, we provide a single point of contact through our email address, devicesandapps@parkinsons.org.uk, and this is for queries and interested parties, including companies making devices and apps, health and social care professionals who want to use or develop technologies in their work, and community members seeking solutions. So please do get in touch if you want to know more. And also, if you like the sound of being part of our community that tests apps and devices as part of our technology panel, likewise, we would love to hear from you. This is an area that people at Parkinson's UK do as an addition to their day jobs because of their enthusiasm and belief in this area. So come join a small, passionate group of people who want to unearth the next big technological breakthrough for supporting people affected by Parkinson's. Thank you for listening and enjoy the rest of the conference. Many thanks.
Hi everyone, welcome to day 3, session 3 of ParkOn on technology, apps and devices. I'll be your host this afternoon for our panel Q&A discussion. I'm Liz Nash, the Research Support Network Manager at Parkinson's UK, and I'm joined by our speakers, Rosie Morris from Northumbria University, Elaine Webster, who worked with Rosie on the development of the iFall app, Natasha Ratcliffe, who's the Research Involvement Manager here at Parkinson's UK, and Jeff Gould, who's our Associate Director of Transformation and Culture. So we'll be very happy to take your questions this afternoon. We're going to kick off with a question for Elaine. Margaret asks, would you work with researchers again on more projects in this way, or did you feel it took up a lot of your time?
Thank you, Margaret. Yes, I would like to work again like that because it suits me. I'm very collaborative and I like process. And in fact, I preferred the fact that it took a long time because it meant that we could refine things and adapt things. It wasn't just a very quick process. It was good working on Zoom because I didn't have to travel. It would be even better if I could visit as well. So I hope that's possible in the future. The combination of people on this project suited me in the attitudes and values that were underlined in that, and that was underpinned by Parkinson's UK and the training that I mentioned. And I would want that again. So I would like to work again, but I would like that same context.
Thanks very much, Elaine. And Natasha, perhaps you'd like to add some information about how we support our patient and public involvement volunteers to get involved with researchers in this way.
Yeah, thanks, Liz, and great question, Margaret, because I think, one of the things that we're really trying to do at Parkinson's UK is make sure that there are different types of opportunities for people to get involved in. And, Elaine mentioned the values of co-production, and I think, it's really important that at the start of the project, if you're working in a co-production approach, that you agree together, like what does that look like and what is the time commitment. So that's something which is really key. And also I think another really nice thing about this project, but there were different types of involvement. There was Elaine and Gerry who were co-producing. There was an advisory group who came in at different stages. So, and again, we're really supporting projects where there's different kind of levels of involvement, and it can be kind of a one-off opportunity, and you can contribute, or you can be more involved, like Elaine and Gerry were.
Thanks very much. Our next question is from Alan, who says, it's brilliant to hear about tech approaches like the iFall app, which could help so many people. What do the panel think needs to happen to empower more people to feel confident to use technology such as smartphones and so on? Rosie, perhaps I could come to you first, please.
Yeah, it's a really great question, Alan. I think something we have learned from this project, and that's in one of the aims of this project, is to test how it's worked. And I think one thing we can learn from this process is that actually a little bit more training time using this app was actually quite important to get people used to it. So perhaps allowing for resources such as training videos. We also had step-by-step guides, which people have found really helpful. So I think just making the technology as accessible as possible and having that support available when it's required.
Thanks, Rosie. And Jeff, any thoughts you'd like to add on that?
Yeah, I guess from my perspective, it's just about giving people confidence in the products that are out there. So just understanding, that users have been involved, people with Parkinson's have been involved throughout the process, but also what I'd like us to do from a Parkinson's UK point of view is really case study those and give people the information that they need to give them the confidence to actually start using some of these applications or devices.
And Elaine, what do you think would need to happen to empower more people to feel confident to use technology?
I think just using it, just not being afraid to make mistakes, because I felt like that if I asked and admitted I didn't know something, I got help. And so I think that's quite, to put yourself forward, to try it and to make mistakes is very important.
I think that's really great advice. And Natasha, any other thoughts on that?
Yeah, I agree with what everyone said around the support, really, and increasing that confidence. And I think peer-to-peer support can be really great as well, and kind of like learning from each other. And I think when you've seen someone else use something successfully, and perhaps it can be a bit daunting at first if you're new to using apps, but seeing others who are similar to you using them can be really empowering and helpful.
Thanks very much, everyone. A question here from Andreas, who says, my dad and aunt have Parkinson's, and I'm an app developer who is trying to develop a Parkinson's app. What steps would you take to make an app more user-friendly for people with Parkinson's? What would be most helpful? Don't know, Elaine, if you'd like to share your thoughts first, followed by Rosie.
Well, I really did think it was quite innovative to have people in right at the start. And I would definitely recommend that the earlier the better. And it's quite a bold step to do that. The model of an expert is such a strong one that it's good to work and listen at the very earliest stages. So I would definitely recommend focus groups or talking with people very early on in the design of it, not just as it progressed.
Thanks. And Rosie, anything to add?
Yeah, I agree with Elaine. I think the most important point is involving the people who are going to use the app or the device. So in the instance of iFall, I'm a physiotherapist by background, and then we had a range of people who were affected by Parkinson's. So that's people with Parkinson's as well as carers. and they were able to input on not only the content of the app, so the different questions we had and answers, but also how it could be used. So, for example, the size of the buttons, feedback, do we have audio recording, do we type, all those kind of logistical things as well. So I agree with Elaine, just having people involved right from the beginning so you can design the product for who is going to use the product. And
Jeff, are there any insights or things that you've heard time and time again from the apps and devices panel here at Parkinson's UK, things that they feel strongly about making tech more friendly?
I think echoing what's already been said, it's about involving the people who are going to be using the product right at the beginning. I guess from a practical steps, we're just looking at our process for reviewing apps and devices at Parkinson's UK. And one of the comments that was made last week was about how we use our own technology panel, because up until now, they've been reviewing apps that are finished products. And to the question, what we can do is come and talk to us, and we're happy to look at work in progress. So if there's apps being developed, we're happy to have that conversation, but also look at the finished product. But we're looking at how we can involve our technology panel in a much earlier stage and get people kind of some really valuable feedback rather than them having completed the app and get feedback that they may not want to hear.
Thanks very much, everyone. A question from Margaret. Margaret says, I only have a computer, not a phone where I can have apps. Can I still use technology and apps? Maybe Natasha, you'd like to share your thoughts on that?
Yeah, and thanks, Margaret. That's a really good question. I think in terms of individual kind of apps and technology, it would depend on how it's been set up, and there are some apps that can be used on computers, but it depends very much on the individual application. But I think it's a really great question, and again speaks to the importance of involving people affected by Parkinson's in the development of new technology, so that these kind of questions come up early on, and researchers and app developers can build into the process from the start the need to have, a web equivalent or things like that. So I think that's definitely something that needs to be explored further, so that we can maximise the use of technologies.
I have a question from Neil for Rosie. Rosie, did the involvement of people with Parkinson's make your research harder or easier?
It definitely made it easier and also much more enjoyable. I found the whole process really enjoyable. We've had, a really great time working together to develop this app. I think involving, more people and actually getting co-production right, and I don't think I did get everything right, but it's been a learning process. So working with more people obviously gives more opinions, but at the end of the day, we've created something that is designed for the people that have been involved, and I think we've created the best prototype we can to date with those opinions and ideas. But as I said, it's also just been a really enjoyable process, so much easier.
That's really great to hear. Thanks very much, Rosie. I see Elaine smiling, so it must have been a positive experience all around. Jeff, I'm going to come to you next with a question from Anne. Anne says, the problem with apps is that they go out of date if they don't get ongoing support and finance. How do researchers and companies who are developing apps ensure that they continue to get updated, and can they be gifted to the Parkinson's community? Do you have any insight on that?
I guess if I look at Anne's question from the other end, I guess what we're trying to do from a Parkinson's UK perspective is provide people with confidence about the apps that they can use. So in my kind of conference talk, I talked about us using a partner called Orca, who run a process of evaluation on apps. And one of the key elements of their evaluation is that they have an app has to have been reviewed and developed within the last 18 months. And I think that's key for us, because that means there is new content being developed or bugs being fixed. And I think from our perspective, what we're trying to do is say that this app is safe to use. And then what we're trying to do with the technology panel is say, actually, it's really useful as well as being safe to use. So I can't speak for individual developers and their ability to keep going, keep developing. But I guess what we're trying to do is ensure that we can show that these have been updated and developed in the recent past.
Thanks very much, Jeff. Rosie, is there anything you'd like to add from a researcher's point of view on app development and keeping things updated?
I think it's a really good question because it is tricky from a research side, and for this app in particular, we are at the next stage. We're looking for more funding to get the app to a better standard, so that if it can go to a review process like Orca, as Jeff's mentioned, it will then be the most friendly it can use. So there are different ways to go about it, but it is a challenge definitely. And as you mentioned, keeping the app up to date and not having bugs in the app is an ongoing piece of work.
Thanks, everyone. I think we have time for one final question, and it is a big one. So the question is, there are so many devices out there claiming to help with Parkinson's. So there's LED light devices, spoons with gyroscopes, glasses that help with walking, but there's no high quality research into them, just anecdotes at this stage. How can we tell if they are actually going to work and be effective? I don't know, who might like to take on that big question first?
I don't mind having an initial go. I think, Anne, it can be a bit overwhelming, and there's lots of, as you say, there's lots of different things. I think from our perspective as Parkinson's UK, as Jeff mentioned, we have processes where we evaluate apps and when we test them with people affected by Parkinson's to make sure that they are useful. And from a research perspective, we also look to see, devices and apps can receive classification of, in terms of if it's helping with symptoms and whether it's classified as a medical device. So that's something as well that is part of our processes of evaluating apps before we recommend them.
Thanks. And Jeff, anything you'd add to what Natasha said?
Only that I think up until now we've been quite focused on devices and apps, and maybe not the sort of living aids that we've just talked about. So I think even last week we were talking about how we can involve that in the process, because what we want to do is or going back, I don't want to repeat myself, but is give people confidence in these. So we're looking at different bodies that we can talk to who can provide that assurance for us, because that isn't our role. Our role is to find those bodies that can give us the confidence to be able to suggest things safely to the community.
Rosie, what would you say to this question?
I would say my role as a researcher and also a physiotherapist is something we really want to try and do. So we are, in the lab that I work in, we're constantly receiving new pieces of technology, and our aim as researchers is to try and prove that they do work and to try and measure them in the best way to show that they are a useful piece of technology. So we're continuously working as researchers to try and identify things that will be really useful for people affected by Parkinson's.
And Elaine, when you hear about these apps and devices and pieces of tech that might support you in your daily life, how do you decide if it's something you'd like to give a go or not? Do you have any tips for us in closing?
I don't know if I've got tips, but I certainly think it's important to still remember the person. And that's what I liked about this project, that the focus was on the person, even in the role I was taking on, that I didn't feel it was about a quick fix, or it was about really listening to people. And so whatever app it is, keeping it simple and keeping it the person at the centre, I think that matters to me. That I don't want hundreds of gadgets, but I want trusted relationships, and I suppose that's what you're saying. These organisations would help with the apps, to trust them.
Thanks so much, everyone. You've been fantastic speakers, a fantastic panel, and we really appreciate you being involved in ParkCon. Thanks to everyone listening today. Make sure to stick around for our final session of the day, and actually the final session of the conference coming up in about 15 minutes after the break. Thanks again, everyone, and hopefully we'll see you soon.